Namaste, I am Dr. Nischal, practicing as a consultant dermatologist at Nirmal Skin and Hair Clinic, Vijayanagar, Bangalore. Dark upper lip. See, the question is very specific. Dark upper lips. As we all know, color is constitutional. The main thing is the pigmentation or the color or the fairness or the darkness of an individual is constitutional. So someone is fair, someone is dark, someone is whitish. So it's a constitutional thing. So naturally, even the lip color is also actually constitutional. Commonly, you would have seen that the lower lip is much pinkish when compared to the upper lip, and that is what it is commonly. However, in certain situations, only the upper lip is slightly darker. So when can it happen? One, as I told you, it's constitutional. Second, it can be due to conditions where there are a lot of dryness of the skin, peeling of the skin, repeated pulling out of the dead skin. So whenever there is trauma to the skin, there can be a little bit of darkness. So sometimes people have the habit of licking the lips and biting the lips. So when that happens, it not only gives darkness, sometimes it can also cause whitening of the lips, means the skin becomes pale and whitish. So either of the things can happen when there is trauma to the lips. Second aspect is sometimes the skin reacts to the cosmetics what we use on the lips. So all the lip coloring agents or the lip moisturizer or the lip creams with lot of fragrance, these things can give rise to pigmented contact dermatitis and the lips may look darker. And another important cause for the darkening of the lips is acanthosis nigricans. See, wherever there is a body fold, sometimes the skin tends to become dark, just like the sides of forehead, around the eyes, this area, neck, underarms, groins. Similarly, sometimes the lip also becomes dark in people with a tendency for acanthosis nigricans. Acanthosis nigricans tendency is actually to some extent genetic, it runs in family. Second, it's hormonal. When people have diabetes, when they have hypothyroidism or PCOD, they can have this condition. Or it can be because of sedentary lifestyle and obesity. So when these conditions are there, the moment we start treating that, even the pigmentation starts improving. So these are some common causes for the upper lip darkening. And based on the condition, we need to treat it. So irrespective of the condition, it is basically melanin which has increased. So the moment the melanin comes down, the lip looks good. Whenever you want to reduce the melanin, first is protection. So when there are dark upper lips, protect the skin with a good moisture with sunscreen and start using skin lightening creams in the night time. Because it's a sensitive area, so usually a low concentration molecule is preferred for the upper lips. Just like any body surface, even for this area, treatments can be done to reduce the melanin. So commonly we do a lighter peel or laser to reduce the melanin. If that is done, definitely we can make it better. Darkness around the mouth is slightly different when compared to the darkness of upper lip. This area of pigmentation can be a constitutional thing where a lot of people have it in family. Second aspect is there's a condition called as pigmentary demarcation line where the color is more here in just below the angles of the mouth. Sometimes people have it on the cheeks in a V or a W shape, or sometimes it happens because of lot of allergic tendency. See, there's a condition called as atopic dermatitis where people are prone for allergies, and when any allergy happens because of the inflammation, there can be darkening around the mouth. Another important thing which can give you pigmentation is dandruff. See, commonly we understand that dandruff happens in the scalp, but not only there, it can also involve your eyebrows, eyelashes, the nasolabial fold here, and also in this region, you can have a lot of seborrhea and dandruff tendency. So when this inflammation happens, naturally people tend to get darkening of the skin. Second aspect is sometimes there is cheilitis, means there is a lot of dryness, itching and rashes of the lips, and that continues around the mouth. Even in this condition, not only the lips but also the perioral area becomes dark. So these are some common causes for darkening of the area around the mouth. And how do we treat? The treatment basically depends on identifying the cause of the pigmentation. See, if something is constitutional or something is genetic, you can't completely remove it. What you can do is maximum you can try to reduce it, and it's so that it looks much better. Whereas whenever it is because of medical conditions like atopic dermatitis or seborrheic dermatitis, so then naturally when we treat that tendency, the color starts improving. Since the skin around the mouth is slightly sensitive, you can't use products which you use for the face pigmentation here many a times. That causes a lot of irritation. So when you are using some creams for the mouth for the pigmentation, it's always better to consult a dermatologist because area is thin and it is prone for a lot of reactions. So whenever the reaction increases, darkness further increases. And whenever there is reaction, first is to reduce the reaction. See, if there is atopic dermatitis, we need to hydrate the skin, we need to apply a lot of moisturizers, we need to reduce the inflammation by a short duration topical steroid cream or steroid sparing creams like pimecrolimus or tacrolimus. And then once the inflammation is better, we treat the pigmentation. And coming to the treatment of pigmentation, since it's a deeper pigmentation, we do combine lasers along with your creams and peels. In this way, if we approach the problem in a holistic manner, definitely we can improve the pigmentation around the mouth and even the upper lips very effectively.